Hi everyone, we're going to get started. So thanks everyone for attending today. I'd just like to introduce myself. My name's Jo Collins. I'm an Injury Prevention Coordinator here at Injury Matters. Today we're hosting this webinar from Desert Blue Connect in Geraldton, so thanks for having us, guys. I'd like to acknowledge the traditional custodians on the land in which we deliver this presentation from today, the Yamatji people, as well as the land across WA from which you're all tuning in from today. So before we get started today, I do have a little bit of housekeeping to cover. Can everyone please make sure that their microphones are set to mute? We do have some time delegated at the end of the webinar for some questions. We would love to hear your questions, so we do strongly encourage you to please send them through in the chat tab, and we'll run through them at the end of the presentation. And if you've also got more than one person in the room with you today, can you please just send us a quick private message in the chat tab and let us know how many people are there listening in with you. So I'd like to start the webinar just by acknowledging that today we will be discussing family and domestic violence, a topic that can be distressing for some people. So if you are, or if you have been impacted by family or domestic violence, there is help and support available. These are just some helplines that you can access 24 hours a day, 7 days a week. So a little bit about Injury Matters. We're for safer people and places. And Injury Matters aims to prevent and reduce the impact of injury within the WA community. And we do this through advocating and providing education for injury prevention, as well as providing support for those that are impacted by injury. So today's webinar is brought to you through our No Injury program with the support of the WA Department of Health. So No Injury is a statewide program in WA, and it aims to enhance the capacity of injury prevention and safety promotion practitioners and organisations to deliver quality injury prevention activities in WA. And so with No Injury, we provide training, resources and networking opportunities. So family and domestic violence, when we talk about that, we're talking about a pattern of behaviours that are intended to coerce, control or create fear within a family or intimate relationship. And this could be something like physical harm or even threats of physical harm, financial, emotional or psychological abuse, sexual violence, or any other behaviour really that causes a person to live in fear. So looking at family and domestic violence in Australia, 1 in 16 men and 1 in 6 women have experienced violence by a partner that they're living with since the age of 15. And in 2019 in WA, 63% of assaults were family and domestic violence related, and Aboriginal and Torres Strait Islander women accounted for 67% of hospitalisations due to family and domestic violence. Between 2019 and 2015, the total cost of family and domestic violence to the WA health system was over 51 million, and that's for people admitted to hospital for assault-related injuries. So we know that family and domestic violence often has ongoing health impacts to those affected, and this includes injuries, poor mental health, anxiety and depression, suicide and self-harm, and substance abuse. Children living in families with family and domestic violence are more likely to experience low self-esteem, learning difficulties and behavioural problems, and also just long-term health effects on their well-being as well. So childhood trauma can have a significant impact on a child's ability to learn, to communicate and to regulate their emotions and behaviour as well. So we recognise that addressing family and domestic violence requires a multifaceted approach using a variety of interventions across primary prevention, early intervention, as well as policy and systematic changes. But today we're going to look at addressing family and domestic violence at a population or a community level. So I'd now like to introduce you to Monica Puccetti and Beth Martin from Desert Blue Connect. So Monica is the Community Initiatives Coordinator at Desert Blue Connect. Monica first became involved with the Community Respect and Equality project when she was completing her Masters of Public Health in Health Promotion at the WA Centre for Rural Health, and assisted with the creation of an evaluation framework for the project. Since then, Monica has assisted in the launch of the CRE Agreement and the day-to-day management of that project. Monica's research interests lie in media advocacy, values-based communication, women's health and gender equality, and the intersection thereof. And so Beth Martin is the Community Respect and Equality Coordinator at Desert Blue Connect. Beth started in this role in April of this year and has been working on engaging with the many organisations and businesses involved in the project and building on its progress as well. So Beth's background is in health promotion and her interests are in gender equality, sexual health and rural and remote health. So I'll just pass it on to you now.
All right. Have a few tech. Okay. So welcome everyone. I'm Beth, and our presentation today will cover the problem of family violence and provide an overview of the Primary Prevention, Community Respect and Equality Initiative. Just to make things a little bit easier, I will refer to Community Respect and Equality as CRE, as it can become quite a mouthful. Monica will cover the Change the Story theory, which has informed the CRE initiative, and she'll go through the 4 gender drivers with examples and go into detail with them. I'll then cover how we've been trying to change the story in Geraldton and go over our CRE actions so far. I'll be focusing on our current main project, which is the CRE Agreement, and provide an overview of how this has been structured and how businesses and organisations can commit to this project. We'll then have some time for questions at the end, so please feel free to save them and Monica and myself will answer them. So why are we trying to prevent family violence in Geraldton? Well, unfortunately, the problem of family violence is a really big issue across Australia. As Joe touched on before, 1 in 6 women in Australia have experienced physical and/or sexual violence over the age of 15. And 1 woman is killed every 9 days within Australia. Looking at Geraldton and within the city of Greater Geraldton region, there's an average of 105 reported family violence incidences a month. And this is just what's being reported. So considering that 83% of women experiencing violence from a current partner don't contact police, it's likely that this number is actually a lot higher. Unfortunately, probably everyone tuning in today has witnessed family violence within their community, whether that be personally, a friend or family member, or whether it's down at the local shopping centre or within our neighbourhoods. So if we can try and stop family violence, imagine how all the time, money and resources spent on response and service agencies could be used within our communities for other important things. We all deserve the right to feel safe in our community, no matter what, and we try and approach this work from a human rights framework in which family violence actually takes away all these rights from people. So a brief background of the CRE project to date. The idea of the CRE started back in 2016 after there had been a particularly busy and horrific week at the Women's Refuge in town. This prompted the discussion of the need to prevent family violence from occurring. Then in 2017, through funding received from the Department of Social Services, an action plan was developed for the primary prevention of family violence in Geraldton, based on the Our Watch Change the Story framework for the prevention of violence against women. The project has been community consulted and developed, and there's still a reference group made up of 16 different organisations that continue to provide strategic direction and support for the project to ensure that it's for Geraldton by Geraldton. The action plan was officially launched in September 2017 by Minister McGurk, the Minister for the Prevention of Family and Domestic Violence. It should be noted that although the action plan was originally funded by Department of Social Services, a number of different actions and components that have come from the plan have been funded by a number of different organisations. So family violence affects us all in different ways, and it doesn't matter who you are, family violence can affect you and your community. So here we have some stats that compare the rates of violence between men and women. We can see that women experience significantly higher rates of sexual and emotional violence. However, men experience slightly higher rates of physical violence. However, what we need to note here is that over 90% of those who use violence are male, and those men who suffer violence often suffer at the hands of other men. Women are more likely to experience severe injury, fear, and death from family violence than men are, which is why we look at family violence through a gendered lens of violence against women. However, we acknowledge that family violence is affected by more than just gender inequality. Family violence is about power, and all forms of inequality affect it, such as socioeconomic inequality and racial inequality. So I'll now hand over to Monica to go through the Change the Story approach.
Hi all, so as you've already heard, the CRE is based on the Change the Story framework, a national framework for the prevention of violence against women that was produced in 2015 by Our-Watch, ANREVS, and Big Health. Our-Watch is a national organization whose founding purpose is to end violence against women and their children by driving nationwide change in the culture, behaviors, and power imbalances that lead to this violence. This framework aims to prevent violence against women by changing the social context and fighting for gender equality. Also, I'd like to take a quick moment to point out a difference between the Change the Story framework and the CRE project. And that is that in the CRE, we're talking about family violence, whereas in Change the Story, it's violence against women. These terms are similar, but not the same. Family violence was chosen as the term for the CRE because it encompasses a wider range of violence experienced in our community and is the preferred term of the Aboriginal community in Geraldton. Family violence does include violence against women in the form of intimate partner violence, but not all violence against women is family violence. For example, sexual harassment often occurs outside the family. Family violence also includes things like elder abuse and situational couple violence, which is not necessarily violence against women, though it can be based on the gender of the victim. I find it helpful to think of family violence and violence against women as a Venn diagram, and that the CRE works in the overlapping space between the two. So what do we actually mean when we're talking about prevention? Well, there are three levels into what we think of as the prevention triangle, which you can see here. Tertiary prevention or response is what most people think of when they think of family violence. And this covers things like women's refuges, counseling support to survivors of violence, family court or other systems that hold perpetrators to account. All of these things sit in the tertiary level. The main point of this level is to prevent the reoccurrence of violence. So at this level, violence has already occurred. Secondary prevention works with high-risk groups to prevent the occurrence of violence. The main difference between these two lower levels of the prevention triangle and the upper tertiary level is that in secondary and primary prevention, violence has not yet occurred. In secondary and primary prevention, we're working to prevent this occurrence, as I said. However, the main difference between the bottom two, and I'll give you a note that the CRE works in the very bottom in primary prevention, is the target audience. So in secondary prevention, like I said, we're working with high-risk groups, not the whole population. In primary prevention, we're looking at whole population initiatives that aim to challenge drivers or underlying causes of violence. So, can I say drivers of violence? We're talking about causal factors. At its heart, family violence is about power and using your power over another person. As violence against women is driven by gender inequality and the resultant power imbalance, to fight family violence, we must fight inequality in all of its forms. This includes the 4 drivers of family violence as conceptualized by the Change the Story framework, which you can see on the slide here. I'll just read those out in case they're a little bit too small. So we're looking at attitudes that condone violence against women, men's control of decision-making and limits to women's independence, stereotyped constructions of masculinity and femininity, disrespect towards women, and male-peer relations that emphasize aggression. However, it must be noted that this understanding of gender inequality as the cause of family violence does not describe the whole picture of violence experienced by marginalized women, such as women with disabilities, Aboriginal and Torres Strait Islander women, and women from culturally and linguistically diverse backgrounds, which is why Change the Picture, a framework for understanding Aboriginal and Torres Strait Islander violence specifically against Aboriginal and Torres Strait Islander women, was created. This is necessary because people who experience multiple forms of oppression, such as Aboriginal women who experience both sexism and racism, often suffer from a higher burden of violence due to these intersecting marginalities, such as this horrifying statistic that Indigenous women are 32 times more likely to be hospitalized due to family violence than non-Indigenous women. That's that 67% that Joe was speaking about earlier. This is because when it comes to forms of oppression, 1 + 1 does not equal 2. Instead, they multiply to create a situation where the violence experienced is both more frequent and more severe. The CRE Agreement, while remaining a primary prevention plan that does not target a specific at-risk group, acknowledges this heightened risk of violence for Aboriginal and Torres Strait Islander women and works to be explicitly anti-racist and fight racism in all of its forms. It also must be noted that our understanding in the CRE of family violence is based on the coercive control model of family violence. This is a type of violence where one partner uses an act or pattern of acts of assault, threats, humiliation, and intimidation or other abuse to harm, punish, or frighten their victim. Coercive control is a strongly gendered type of violence, as Beth alluded to earlier, with women being the predominant victims and men the predominant users of this type of violence. However, the new model you see here from Heather Nanakaro's new book, Unintended Consequences of DV Law, reconceptualizes the typologies of violence seen in community and is especially relevant to Aboriginal and Torres Strait Islander communities, as it widens the understanding of different types of violence, such as understanding the difference between violent resistance and coercive control. For example, coercive control is when a woman is constantly stalked, monitored, or isolated by their male partner. They may also have their finances restricted or be constantly belittled and verbally abused. This is as opposed to situational couple violence, where both partners cannot manage their emotions and fly off the handle, as it were. This can be circumstantial, such as conflict over children, or alcohol and drug related. However, the key here is that there's no power control displayed either way. Power and control is at the heart of coercive control type and the coercive control typology of violence, and that's what we'll be dealing with. So how exactly does gender inequality cause family violence? Well, the way the CRE and Change the Story conceptualize this is that gender inequality creates the necessary social context for violence against women to occur. This means that all of the drivers I spoke about previously feed the idea that women are the possessions of men, which creates a world in which men's violence against women is acceptable and the norm. The first driver is attitudes that condone violence against women is pretty easy to understand. It's things like the quotes on these posters from the line. She was asking for it. He did it because he likes you. These quotes excuse and minimize violence. You can think of these attitudes as the more overtly sexist comments. And moving on to driver number 2, men's control of decision-making and limits to women's independence. We're getting into the structural roots of sexism, the things that work together to create a world in which women are financially second-class citizens, something that enables things like financial abuse, or may be simply a barrier in and of itself to a woman leaving a violent relationship, because without the partner as the primary breadwinner, she may not have enough money to safely leave. Considering that in Australia, women earn on average $253 less per week than men, this adds up to a lot over time in less savings, less super, and often less time in the workforce due to time off for childcare duties. Unfortunately, WA has the worst wage gap in the country, with men earning 22.7% more than women. The ACT, on the other hand, is leading the way with the wage gap down to 8.1%. In one small bit of good news, The wage gap is decreasing in WA, as last year it was about 23.1%, so small grounds. If you're still skeptical about how men control decision-making, think about gender inequality in Parliament or in CEOs. For example, out of 200 ASX-listed companies, only 11 of those CEOs are women. In comparison, there are more men named Andrew, 14, who are CEOs of these companies than all of the women combined. This matters because it perpetuates the gender inequality that drives the power imbalances that allow men to exert the power over women. However, like I noted before, there are some points of improvement, such as 2019 having a record high number of women in directorships at 29.7%. So what we're doing is working slowly but surely. Okay, so now that we've discussed the more explicitly sexist attitudes and the structures that enable gender inequality, we're moving on to the third driver, rigid gender roles and stereotype constructions of masculinity and femininity. And now it's important to note that gender roles in and of themselves are not inherently bad, but it is the rigid adherence to and policing of these gender roles that's harmful, especially when women occupy a lesser role in the gender binary of roles. So now I'm just going to play a quick video that helps us to better understand and see a lot of the gender roles that we are unconsciously policing or creating. And let's hope the technology plays well.
Not only are girls seen as objects by other people, they learn to see themselves as objects.
There's still so much work that has to happen with girls about identity and about the emphasis placed on beauty and body. But for boys, there's been no similar kinds of movement at all. Boys are still led to believe that power is associated with domination. We need to redefine strength in men, not as the power over other people, but as forces for justice. And justice means equality and fairness, and working against poverty and working against, inequality and violence. That's strength.
We're creating new leaders, and they're going to not look like how they always did. That is the true reflection of this country and of this world.
Okay, so thank you for taking the time to watch that, guys. I really appreciate it. And if you want more information on the representation project, just go to that website that was on the screen. I really recommend it if you're interested in this area. I did want to leave you with one last note, that growing up in a society of rigid gender roles can be kind of like being a fish in water. The fish have never lived outside of the water, so they can't actually even see the water until they're taken out of it. In this way, it can be hard for us to see gender roles, and when we haven't seen any other way of being in regards to gender. But the first step in decreasing the rigidity of these roles is first in acknowledging their existence. So that's why we have things like the representation project. And our final driver, if we can get to it, hopefully. There we go. Our final driver is disrespect towards women and male peer relations that emphasize aggression. So I'm just going to play a quick little ad from the Victorian government. It's 30 seconds. I also won't take too much time, and then we'll have a chat about it.
It's okay. He's just being a boy.
Don't worry, Mum. I know it's okay for boys to push girls.
Yeah, and when I grow up, I guess it'll be okay if I'm violent with women.
Sorry, that's not what I meant. Authorised by the Australian Government, Canberra.
So, similar to the gender roles, disrespect towards women and male-peer relations that emphasize aggression can be just as hard to see. And they're often things that we don't even think about when we're saying, just like the woman in the video. So just like with the rigid gender roles, the key here is to get people to start thinking about what we're saying and doing and how this affects others and the culture we're raising the next generation in. So this is a little bit about drivers versus reinforcing factors. The drivers of family violence are what create the necessary social context for violence to occur. Without these, violence is less likely to occur. This has been proven over many different studies, specifically around looking at an international context of what's likely to be predictive of family violence. However, reinforcing factors such as drug and alcohol, these things make violence worse and more frequent, but in and of themselves do not cause violence to occur. When you remove these from the picture, the violence is often experienced in a less severe, less frequent way, but does not disappear entirely. This is why we are targeting the drivers of family violence, such as inequality in all forms. The CRE plan explicitly focuses on changing the drivers of family violence to attempt to end family violence altogether, but also acknowledges the role that reinforcing factors, such as the condoning of violence in general, experience of and exposure to violence, especially as a child, harmful use of alcohol and drug, and backlash factors. However, because the CRE plan is focusing on family violence rather than simply violence against women, we differ from the Change the Story framework by conceptualizing all forms of inequality, such as racism and sexism, as drivers of family violence. And with that, I'll pass it back to Beth to talk about the CRE plan.
So some of the actions that have come under the CRE plan so far was in 2017, there was a CRE summit held. This is where the CRE action plan was officially launched. And it was a one-day event that featured keynote speakers discussing the primary prevention of family violence with over 100 people in attendance. Other networking and education provided under the plan was the CRE Sundowner held in November last year, where Tanya Sassoni, the Executive Director for CEOs for Gender Equality, was able to discuss some different strategies for promoting gender equality within organisations and how to implement them. Also in 2017, there were 13 community members who stepped up to become champions in preventing family violence. After training to prepare them with the appropriate knowledge and skills, they were able to create and promote their own messages about family violence in Geraldton, which you can see some of them up here on the screen, as well as them attending awareness events and activities. There was also the CRE Week, which was held in 2019 and encouraged local organisations and community to either hold or attend an event focused on the prevention of family violence during the week. So some of the events included a community breakfast, a lunchtime walk along the foreshore, a drop-in play group, and numerous in-house morning tea wear white days. So across the week, there was 11 different events, of which almost 300 people attended and over 20,000 people were reached through social media. So the CRE Week was planned to be an annual event. However, due to COVID, it was cancelled this year in April. So the next CRE Week will be held between the 10th and the 14th of May next year. And then a large and continuous component of the CRE plan is the CRE Agreement, which is for organisations and businesses or sporting groups, associations in Geraldton to collectively say that violence is never okay in our community. So at the moment, we have 31 organisations who've signed the agreement, and you can see most of their logos here on the slide. So the diversity of the businesses and organisations who have signed on is a real testament to the fact that the CRE can work in any workplace. For example, the ports here in Geraldton are a very different organisation to Desert Blue Connect, and they were the very first people to sign up, and they have been very engaged and proactive about equality and respect in their workplace. So why do we want organisations to sign onto an agreement? Well, it's likely that staff within their workplace are experiencing family violence, with 60% of women who are experiencing violence from a current partner being in paid employment. And more than 75% of women have actually reported experiencing unwanted or unwelcome sexual behaviour at work. And it's also costing our businesses. So 22 billion is the estimated cost of family violence against women and their children to the Australian economy. There are also, of course, many benefits of workplaces taking action in this area. Them being having improved organisational culture, so an increase in employee morale, having a shared understanding of respectful relationships and employees feeling respected and valued, and having available support for those who may be experiencing family violence. It's also going to lead to increased productivity. So we know if employee morale is high, then staff are more likely to be productive. And this is also going to result in being able to attain and retain quality employees. Then in our workplace development, it allows for an opportunity to educate and upskill employees on family violence and where to get help, as well as an opportunity to integrate best practice interventions into the workplace and to review policies to prevent gender equity, to reflect gender equity, as well as providing a workplace that is safe for all people. And then corporate responsibility. So creating a socially responsible organisation and being a role model as a regional leader in the prevention of family violence can bring significant positive media exposure for organisations and businesses, which is going to attract, again, more quality employees, as well as assisting them with being able to obtain more opportunities for their business, as people want to support organisations that are corporately responsible and socially. So what are organisations committing to by signing the agreement? So they are committing to these agreed values and codes of behaviour within their workplace. So there's community collaboration, standing up, speaking out and working together with others for a violence-free community. This is really important as it can't just be one organisation working to prevent family violence. It needs to be across the community to truly create change. Respect and cultural diversity. So this is about acknowledging and valuing traditions and cultural differences that do not infringe on human rights and demonstrate respectful relationships with family, friends, work colleagues and other community members. Equality, so this is supporting gender equality by promoting women's independence and decision making in the workplace, whether this be working towards having more women on their boards or in leadership positions within the organisation, and supporting them in professional development opportunities to be able to take on these roles. Safety, so promoting non-violent attitudes, language and behaviour to create a safer workplace and community, and making sure that the managers within the organisation are really leading by example and taking harassment reports seriously. And lastly, social justice. So working together to address unequal norms and practices and structures that lead to family violence. So looking at some of the policies and practices within the workplace and seeing how they could be gender biased. There's the Our Watch Workplace Equality and Respect Staff Survey, which might be a good starting place for organisations to go through and have a look at areas where their workplace may be able to improve. So there's also an accreditation process in signing onto the agreement. So at the moment we have a level 1 in the agreement, and it was planned to keep this level very practical and achievable. Therefore, it's simply about introducing and creating awareness of the CRE and family violence into the workplace, with the aim of these actions not being too overwhelming for organisations. So we ask that 7 items are completed for accreditation, but businesses can do all of them plus more if they would like. So some of the ways of achieving level 1 accreditation are through promoting the CRE agreement through posters, family violence brochures in the workplace, and promoting CRE messages through social media or through other communication channels. There's raising internal awareness by including the agreed values and codes of behaviour in induction packages, and incorporating discussions into toolbox meetings, or perhaps having a designated family violence or CRE representative within the organisation. There's also engaging with community by participating in things like CRE Week or our Walk Against Violence event, or another family violence event within the community, or perhaps holding an internal event for staff members. And then there's also a section where organisations can choose a particular action that suits them and that works for their organisation. So this is a really important aspect of the agreement to ensure that it's adaptable and flexible to suit all workplaces. So where to from here? Everyone's at different stages with the accreditation. So some organisations have actually become accredited in level 1 recently. So Headspace, Midwest Ports Authority and the WA Centre for Rural Health, while others have only recently signed up, or there's been a change in staff or a lack of capacity for organisations to progress through some of the actions. However, with now having a full-time position funded for the project, it has increased our capacity to provide some extra support for organisations signed on. We're currently also working on developing a toolkit that will contain all the documents and resources that organisations will need to implement level 1 of the agreement. So hopefully this will make things a little bit more effective and efficient for organisations, and we'll hopefully actively advertise that to the non-social health service sectors once that toolkit is developed, as they can be a little bit harder to engage. Going forward, we would also need to develop level 2 and 3 for accreditation, which will be more focused on the education and policy level side of things that organisations can choose to go on to after completing level 1. With saying that, some organisations have already started to progress to those steps themselves, so it's great to see a natural progression towards this as either after or as part of level 1 of the agreement. And then some key learnings, if this was something that you were thinking about trying to implement in your own community. So it's really important that you find the champions in your area that are really going to help drive the project. And then of course, funding is important, whether the project can start within someone's existing position, but then as momentum increases, it might need to become a shared role or perhaps an additional role created. Unfortunately, preventing family violence is a long-term undertaking, and we're going to see an increase in incidences as people become more aware and more supported to actually report before we start to see a decrease in family violence incidences. So then being able to find funding that is sustainable and continuous for a long period of time is definitely a challenge, as I'm sure most of you are aware. Every community is also going to be different, so what we've done here in Geraldton may need to look a little bit different wherever you are. And I guess a really important aspect of that is the community collaboration. So speaking to community members and having different organisations and businesses involved means that what you're going to create will be made for your community by your community. And this will hopefully ensure that it will be suitable. It does take a whole community. It can't just be one person or organisation trying to create change to the social attitudes and behaviours that have developed over thousands of years within our society. So on that note, that brings us to an end of the information that we're delivering. So if anyone has any questions, please feel free.
Hi everyone, I'm just going to take the screen back. I'll just get you to stop sharing. Okay, so we have had a few questions come through. A couple of people have asked if we're going to be providing a recording of the webinar following the webinar today, and yes, we will. So we've recorded the webinar and we'll be posting it up to our No Injury website afterwards for you to have a look at and share among your networks. I've got a question sent through from Alison Alari at Injury Matters. Have you evaluated the CRE action plan? If yes, what are the results?
So I can take that. The evaluation framework, which was built back in 2018, was looking more at progress evaluation. So if the steps in the strategic action plan have been implemented, we are working on a more outcomes focused evaluation with WACRA. They're assisting us there with the local community attitudes and exposure to violence survey. So that's looking at, okay, are we actually making any change? And because with evaluation of something that's such a long-term problem like family and domestic violence, we're actually likely to see an increase in incidents of family violence before we see a decrease due to the due to that 83% that Beth mentioned earlier. So instead of looking at actual incidents, the first thing is our community attitudes. Sorry. Okay. I'm getting confused with the tech. Forgive me. I was talking about community attitudes. So that's what WACRA's doing. They got 1,000 people last year to answer that survey. We're still waiting on a full report. And that survey will hopefully go through every 2 to 3 years. But that's the great thing about a project such as this, that it's not all Desert Blue Connect doing it. WACRA's got great capacity in the evaluation area, and they're running that with us. So hopefully that answers your question.
Right. And so we've got another question through from Athena Beck, and that's just about how do you sign your own organisation up to the CRE agreement?
Yeah, so if it's an organisation within Geraldton, you can either jump onto the Community Respect and Equality website, and there is the form that just needs signing and then sending back to Desert Blue Connect. If you'd like any further information, you can also email me at bethm@desertblueconnect.org.au, and I can get in touch with you and we can go through everything, provide you with some few resources for you to then take back to, I guess, managerial positions or people who are making the decisions within the workplace and would probably want to sign that form as well. So yeah, either jump on the website or give me an email.
All right, and just one more question. Oh, let's have a look. Have there been any interest in other regions developing a similar project?
So I think there's recently been some interest from Carnarvon, and then we're also really lucky that WACRA were able to organise a roundtable for organisations throughout WA that are working in the primary prevention space. So we were able to share the agreement model with them as well. So there's definitely been a little bit of interest, but I guess, like I said, it might look quite different for different regions.
We definitely advocate for not a one-size-fits-all approach. So we're actually hopefully going up to Carnarvon in a month to chat with people there and maybe share some learnings too.
So that's all the questions we've got for today. If you have any more, definitely send them through. Okay, so just keeping the conversation going, we've got a few different family and domestic violence resources. So we've got Injury Matters Family and Domestic Violence in WA fact sheet. We've also got a violence resource kit, which has a bit of a broader look at violence in WA. And I also just have popped up on screen there, the path to safety. So that's WA's strategy to reduce family and domestic violence from 2020 to 2030. That one was launched by the Department of Communities earlier this year. And that sets out a government and community plan for reducing and responding to this issue over the next decade. And I also just want to highlight the upcoming 16 Days in WA campaign to stop violence against women. So that campaign will be running from the 25th of November from the 10th of December. And that'll sort of just be more of an awareness raising sort of campaign to increase positive actions to end violence against women in WA. So the theme for the 2020 campaign is Respect Starts With You. And I think it's just really important to show that everyone does have an important role to play in preventing violence. If you're interested, then hop on to the Department of Community's website for the campaign toolkit to learn about how you can get involved in that campaign. So just looking at injury a bit more broadly, we do run through Injury Matters a range of different trainings across a broad range of injury issues. Our next Injury Prevention Network meeting will actually be held in Geraldton this Friday for anyone that might be listening in from Geraldton at the moment. And the Injury Prevention Network meets quarterly to provide practitioners across WA just with that opportunity to connect with each other and to share your learnings and solutions in injury prevention and community safety. If you're interested and you're in Geraldton, please definitely get in touch with us. Otherwise, you can also attend online as well. And for anyone else that might be tuning in from Geraldton or surrounding areas, we'll also be hosting a broader injury prevention lunch and learn on Thursday at the WA Centre for Rural Health. So you can come along for a free lunch and a chat about injury prevention in the Midwest. So just a few next steps. We also run the Connected program, and this provides you with the opportunity to build your professional network and keep you engaged in today's conversation and also around injury, more broadly speaking. So the Connected's a networking program where participants are randomly paired bi-monthly just to have a quick catch up, a quick 15-minute conversation with another professional that's working in the injury prevention space. We also really value your feedback. When the webinar ends in a moment, an online evaluation form will pop up on your screen. We'd appreciate it if you could just take a few moments to complete that evaluation for us. So that brings us to the end of today's webinar. I just want to thank both Beth and Monica for presenting today and for everyone for tuning in. Thank you.